Okay, so this is section 4.3, effective communication. So the objectives of the section is to list the three main factors of the communication process, identify four factors that can interfere with the communication process, explain the importance of listening, nonverbal behavior reporting, and reporting in the communication process, to justify the importance of recognizing cultural diversity. So, communicating effectively with others is important. Healthcare workers must be able to relate to patients, family, coworkers, and other professionals. Understanding of the communication skills will assist a person who is trying to relate effectively. So, communication is the exchange of information, thoughts, ideas, and feelings. It can occur with verbal means or through spoken words, written communications, and then nonverbal behaviors such as facial expressions, body language, and touch. Communication involves three essential elements. You must have the sender, who is the individual who creates a message to convey the information or an idea to another person. You must have the message, which is the information, the idea, or the thought. And then the receiver is the individual who receives the message from the sender. Without a sender, the message, and the receiver, communication cannot occur. You must have all three of those. So feedback is a method that can be used to determine if communication is successful. Because when the receiver responds to the message, it allows the original sender to evaluate how the message was interpreted and to make any necessary adjustments or clarification. So according to the feedback that the sender receives, then they can decide whether further explanation is needed or not, or if the receiver understands the message completely. And the feedback can be verbal or nonverbal. A good way to look at a person's facial expression. They may say that they understand, but their face says that they're confused. Many factors can interfere with completion of the communication process. And there's also many important elements of effective communication. So one is the message must be clear. It must be in terms that both the sender and receiver can understand. You don't want to use medical terminology because many times our patients and their family members will not understand the medical terminology. Terms must be modified, defined, or substituted with different words when the messages are conveyed to others. So instead of saying a patient had a cardiovascular accident or a CVA, then you might say they had a stroke because that's what most people understand it to be. A healthcare worker needs a urine specimen, so some patients can be told to urinate in a container and they would understand what that means. Others, you may have to tell them to pee or do number one in the container. So you just have to voice it in a way that the person understands what you're saying. Effective communication requires constant practice and experience to learn and to create a message that can be clearly understood. The sender must deliver the message in a clear and concise manner. So correct punctuation and the use of good grammar are essential. You want to avoid the use of slang words or words with double meanings. Avoid meaningless words such as, all that stuff, and okay, which can distract from the message. And a good way to know if you're using those meaningless terms is to record yourself. Tone and pitch of your voice is important. You want to use a moderate level, not too soft or too loud. You want to make sure if it's too soft, then the receiver is not able to hear you. If you're too loud, it can be distracting to them. You want to use a good inflection to avoid a monotone. So you don't always want to talk in the same tone of voice because then it's really boring and the people want to fall asleep. Written messages should be spelled correctly. It should also contain correct grammar and punctuation and should also be concise. Usually, if you're able to get away with less words, then do so. The proper rate of speed is also important. If a message is delivered too quickly in a rushed manner, the receiver may not have enough time to hear all parts of the message. But if it's too slow, it can be boring to the receiver. So this is something that we talked about in the Zoom meeting on Friday for some of you. Whereas you get to know what you're going to say, and you're used to repeating the same thing over and over, and it's easy to talk too fast during that time. So you have to make sure you talk at a speed that your receiver is able to understand. The receiver must be able to hear and receive the message. Patients under heavy medication or who are very weak may nod their head as if the message was heard, but they are not actually receiving the information. They may not hear it, and they may not be able to interpret and understand it because of the physical state. So I saw a patient one time. He had just come out of surgery not very long before I went to see him. And I would ask the patient a question, and he would answer, and then he would start snoring immediately. And then I would ask him another question, he would answer, and then he would start snoring immediately. And he had some family members that were in the room, so I would look to the family members to see if he was answering the questions correctly. He was answering the questions correctly. But of course, at that time, I did not do any education with the patient because he would not have remembered later on what I educated him on. So I was able to get my questions answered for the evaluation, but there was no treatment or education because he would not have remembered it. Examples of people who may not be able to receive messages are patients with hearing or visual impairments, patients with limited English speaking abilities. So ways to allow the receiver to respond is to repeat the message. And again, we talked about this also on Friday, is to make sure that the receiver understands what you're saying. A good way is to have them to repeat what you said. You can also change the form of the message if they're not understanding how you are saying it, say it in a different way. And you can also have others get to interpret or clarify the message. So when I worked in home care, I asked my patients about urinary incontinence. And I would usually say in the beginning, do you have any urinary incontinence? Which is when you're not able to get to the bathroom on time. And most of the time they would say no. And then I would continue to clarify, are your pants ever wet when you get to the bathroom? Do you ever leak or dribble urine before you get to the bathroom? So I would say it in 3 or 4 different ways to make sure they completely understood what I was asking of them. A receiver must be able to understand the message. Avoid using unfamiliar terminology. Again, that's the medical terminology. It can cause a break in communication. Or people may think that, oh, you're just trying to use big words to show us how smart you are, too. Meaning people do not admit that they do not understand things because they think others will think they are dumb. So again, that goes back to, again, that we talked about on Friday, that many won't say they don't understand what you're saying because they don't ask questions and they don't want others to think they're dumb. Ask questions to repeat the information that you give them in different terms to increase their ability to understand. The receiver's attitude can also interfere with understanding. If a patient thinks the healthcare workers do not know what they are talking about, patients will not accept information presented. So again, this is why your body language plays a role in this. When you go and you want to speak confidently, that you know what you're talking about. You don't want to say, well, they may have this, but I just don't know. Obviously, there may be times when you don't know exactly what they have, but even when you say that, you would go and say it's a possibility that this is the diagnosis, but we need to do further testing to rule to make sure it's the correct one and to rule out anything else. The receiver must have some confidence and belief in the sender before they will accept and understand a message, and that's when the relationship between the healthcare workers or a healthcare professional and a patient or family member is important. Healthcare workers must be willing to say, I don't know, but I will try to find that information for you and ask a question which you do not have the correct knowledge. It's always important that you admit that you do not know the answer and you just find the answer or you ask somebody who would know. Healthcare workers must be aware of their own prejudgments and attitudes when receiving messages from patients. If they think patients are lazy, ignorant, or uncooperative, they will not respond correctly to messages patients send. So again, we talked about this on Friday too, where our patients are going to look at us and they're going to have assumptions about us. And healthcare professionals can do the same regarding their patients. You want to make sure you don't have those preconceived notions regarding your patients affect how you talk to them or how you treat them. You must be aware of these feelings and work to overcome them to accept patients as they are. Interruptions or distractions must be avoided during communication. They can interfere with communication. Talking with others while answering the phone or writing can decrease the effectiveness of the spoken communication. Also, loud noises, distractions in the form of bright lights or uncomfortable temperature can interrupt communications. So if let's say a patient asks you a question and you're typing on the computer and you just continue to type on the computer as they talk, they're going to think that you're not listening to them. Sometimes, and you will definitely need to type or write stuff down as a patient's talking to them. And it's completely okay to say, I'm just writing this down as you tell me so I can make sure I get it down correctly and that I don't forget it later on. Many times I would go to see patients and they would have the TVs on. Sometimes it was very loud, sometimes it was muted. Many times I would ask them to at least turn the volume down or even turn it off if it seemed to be distracting the patients. Of course, I would always ask you don't ever just turn down their TV, whether they're in the hospital room or in their own home, because that would be rude and disrespectful towards the patient. So when they're talking, when you're talking with the patients, you want to make sure there's not distractions around. So that they can hear what you're saying. Another example is a child jumping around or climbing up and down. Often mother's lap will distract the mother as she is giving instructions from a healthcare worker. Loud televisions or radios interfere with verbal messages because the receiver may pay more attention to the radio, the television, than the person speaking. So limit distractions if meaningful communication is to take place. Our phones are a big distraction, or tablets right now. If you've ever gone to your parents and have asked them a question while they're looking on Facebook or looking on their computer and you have the feeling that they didn't hear anything you said. I know my daughter has said that a few times where she's asked me something or told me something later on, she reminds me and I don't remember what she said. Or she's like, Mom, you need to put that down so you can hear me and listen to me. So that's something that is a distraction currently. Here's a video. We are not going to watch it. I'm not going to play it during this video because you will not be able to hear. It's a great one to listen to, so go back and watch it. Communicating with the elderly and disabled, it's important that you don't treat them as children or you don't automatically assume that they're deaf, so you talk really loud. So again, it's a good video to watch. So listening is an essential part of effective communication. It means to pay attention to and to make an effort to hear what the other person is saying. I think a lot of times when people are listening, they're more thinking of a comeback or thinking of what else they're going to say, and maybe thinking of something completely different. So they're not fully listening to what the other person is saying. Good listening skills require constant practice. Techniques that can be used to learn good listening skills is show interest and concern for what the speaker is saying. Look at them, pay attention to them, stop what you're doing, and show interest. Be alert and maintain eye contact. So look at them in the eye. Don't be, when they're talking, you don't want to look past them or look all around the room, looking your butt at them. So you want to make sure you look at them and maintain eye contact. Avoid interrupting the speaker. Again, you want to listen to what the person has to say completely before maybe you want to be, like if you have a question what they're saying or if you need a clarification, wait until they're done talking. Pay attention to what the speaker is saying. Again, don't be thinking of what you're going to say next or what questions you're going to ask. Avoid thinking about how you're going to respond. Try to eliminate your own prejudgments and see the other person's point of view. So don't assume that you think you know what they're going to say, or don't have your prejudgments kind of hinder how you're listening to what they're saying. Eliminate distractions by moving to a quiet area for the conversation. Watch the speaker closely to observe actions that may contradict what the person is saying. So look at that nonverbal communication. What is their face telling you or their body language? Reflect statements back to the speaker to let the speaker know that the statements are being heard. So many times when my patients would tell me what was going on, maybe that they had increased pain after doing exercises, or their shoulder hurt, or they're having shooting, stabbing pain, whatever it may be. A lot of times I would write what they were saying, and then I would just say, okay, I'm just going to repeat what you said to me, just so I can make sure I have it correct. And then I would repeat what they said to me, and then they would say yes or no, or that's right. And then it also shows them that you're listening to them and that you heard what they said and understood what they said. Ask for clarification if you do not understand part of the message, and that is so important. If you're not understanding, it's important to ask a question. And a doctor may be giving you instructions, or a nurse may be giving you instructions. So if you don't understand what they're telling you, it's important to ask. Keep your temper under control and maintain a positive attitude. So sometimes what they are telling you may not be happy with, or you're getting upset, and you need to try to keep your cool, count to 10, relax, and listen to what they're saying fully, so that you can make sure you fully understand what they're saying to you before getting really upset or really mad. Good listening skills will allow you to receive the entire message a person is trying to convey to you. Observe the speaker closely to watch for actions that may contradict what the person is saying. So here's a video. Again, I'm not going to play it. What I want you to do is go ahead and watch the video without any sound and just think about what their nonverbal communication is saying, or what you think they are talking about or saying, and then go ahead and listen to it with sound. It's a classic movie, one of my favorites, My Fair Lady. So just look at nonverbal communication. So nonverbal communication is the use of facial expressions, body language, gestures, eye contact, and touch to convey messages or ideas. Two different messages conveyed if a person is smiling and sitting in a relaxed position while saying, I'm very angry. So if they're smiling, then they're probably not all that angry, right? You can convey messages with a smile, a frown, a wink, a shrug of the shoulders, bored expressions, or tapping of fingers. So make sure your nonverbal communication is relaying what you want relayed. So again, if you're standing like this, you may stand like this just because you're cold or your hands are cold. But what is that telling the receiver? It usually looks like you're mad, but you may be standing like that just because you're cold. So maybe instead put your hands in your pocket to warm up your hands, or if you're cold, wear warmer clothes. So just be aware of your body language and what you're saying to others. Okay, board expressions, tapping of fingers or feet, and other similar body gestures or actions. It's important to have coworkers to be aware of their own and patients' nonverbal behavior. A touch of the hand, pat on the back, a firm handshake, and hug can convey more interest and caring than words. Sometimes, as my patients were talking to me, if I could tell they were upset, I would move closer to them, lay my hand on their arm or even their leg sometimes, just to let them know that I cared about them and I was showing interest in them. And then sometimes our patients, nobody touches them. If they live by themselves, they may not have anyone touch them. And when you take their blood pressure or you take their pulse, that's not like a true comforting touch. When verbal or nonverbal messages agree, then the receiver is more likely to understand the message being sent. So don't send mixed signals to your patients and their family members. Barriers to communication, something that gets in the way of clear communication. So there's 3 common causes of barriers: physical disabilities, psychological attitudes of prejudice, and then cultural diversity. So physical disabilities could be deafness or hearing loss. People who are deaf or hearing impaired have difficulty receiving a message. So sometimes if they're hearing impaired, if you speak up louder, they may be able to hear you better. Sometimes it's the tone of voice or like your tone of voice can affect somebody who can hear you. So I remember I was with another PT and when we would co-treat a patient that was hard of hearing. She usually had me talk because for whatever reason they could hear me better than hear her. So just be aware of that. But if they are deaf, do not speak out and do not yell at them. They're not going to hear you. To improve communication with those who have hearing loss or who are deaf, use body language such as gestures or signs to help convey what you're saying. Speak clearly and in short sentences because they may be able to read lips. Again, if they are able to read lips, you need to make sure you face the individual so they can read your lips. Write messages down if necessary. I had a patient who was deaf and she became deaf later on in life, so did not know sign language. And so she had a boogie board and we would write everything down. Sometimes I would still talk because it's hard not to. But everything was written down. I wrote down each question and she would answer it. She was able to talk just fine. And I would always plan for an extra 15 to even a half an hour for her visit because it would take extra time to write everything down. Doing arm exercises on the boogie board, I would write follow me, and then I would show her how to do the exercises, and that seemed to work pretty well. Make sure any hearing aids have good batteries and are inserted correctly so that they are working properly for the patient. At times it may be necessary to obtain the assistance of a sign language interpreter to communicate with a deaf individual. Blindness or impaired vision. They can hear what is being said, but they will not see body language, gestures, or facial expressions. You want to make sure you use a soft tone of voice with them. Describe events that are occurring. Announce your presence as you enter a room. Explain sounds or noises and use touch when appropriate. So again, when you're entering the room, you want to make sure you're coming in. Announce that you're coming in so they can hear you. And also say who you are so they know who is coming in. Sometimes you may, if I was doing an exercise with someone who is blind, it was hard because you can't always show them how to do the exercises. So I would ask, can I just touch your hands here and I'll show you how to do the exercises and go through the motion with you so that they would know how to do their correct exercise. Aphasia or speech impairment. Aphasia is the loss of impairment of the power to use or comprehend words, usually as a result of injury or damage to the brain, usually after a stroke. They get difficulty with not only the spoken word, but also written communication. They may know what they want to say, but have difficulty remembering the correct words. They may not be able to pronounce certain words. They may have slurred or distorted speech. It may be very difficult to understand what they're saying. And it's so important to be patient with them because you really have to take your time. After you ask a question, they may wait longer before they answer. And allow them to try to speak. So ask your question, allow them to try to speak and try to say what they're saying, and don't try to keep interrupting and saying what you think they want to say. So I think I showed you guys this video before, but I can't remember. And this is a gentleman with aphasia, so you can understand what it is. Again, I think I showed it to you before, but maybe I didn't. Maybe I don't know. I forget. So go ahead and watch the video. It's a good video if you have not watched it in class. A good example of what aphasia is. So the pink and black board there is a boogie board that I use for my one patient who is deaf. And then these are other communication boards that a speech therapist may give to a patient. You can see if they're hungry, they can point to the eat sign. If they have to use the toilet, they can point to the toilet. It says, I want to be suctioned, or I want my lips moistened. I am short of breath, I'm in pain. Or they can point to letters to spell out what they want to say. So these are all helpful. Again, with aphasia, with those who have difficulty speaking, I had a patient who had it, and so I would ask her a question, and she would always say yes. Her first answer was always yes, And then I had to wait and pause for a bit. And then she would say either yes or no again, and that second answer was the correct answer. Or, do you have pain? She would say yes. And then I would wait, and she would say no sometimes, or she would say yes, and I would say where. And it would take her a minute. And most of the time, she would show me where she had pain at. So it's just each patient with aphasia is different, and you kind of have to get to know what works for them and what doesn't work for them, or their family members or caregivers may be able to help you with that also. And writing it down does not always help. But you could point to different areas. You have pain here, and they might be able to say yes or no. But it's just really taking the time to be patient with them. Healthcare workers should ask questions that require only short responses. Speak slowly and carefully. Encourage them to take their time. So again, if they're trying to say something, don't keep interrupting them. Just let them take their time. And they get frustrated very easily. Pause between sentences to allow them to comprehend what is being said. Healthcare workers should repeat messages to be sure they are correct. So like I said, with my one patient, sometimes I'd ask the question twice, and sometimes I would wait for her to answer the second time. Encourage patients to use gestures or point to objects, provide writing materials that they can write messages, or use pictures with key messages to communicate, like the picture boards I showed earlier. Psychological barriers are often caused by prejudice, attitudes, and personality. For example, closed-mindedness, judging, preaching, moralizing, overreacting, arguing, advising, or prejudging people. Judgment of others is too often based on appearance, lifestyle, and socioeconomic status. So people may have prejudgments for somebody who's rich. People may think, oh, they're going to be snotty or moody or high maintenance. They're going to expect everyone to do everything for them. And then really, that rich person could be very down to earth and very grateful to everybody who's helping. Someone who is poor or very low income, people may automatically think they're not educated, and that may not be the case. They may be very educated. So don't judge them according to how much money they have or what they look like or their lifestyle. Everybody has a different lifestyle, then don't judge them on that. Stereotypes such as lazy bum, dumb blonde, or fat slob result in snap judgments being made about an individual and can affect communication process. So just don't prejudge your patients. Healthcare workers must learn to put prejudice aside and to show respect to all individuals. A homeless person deserves the same quality of healthcare as the President of the United States. It's important to respect each person as an individual and to remember that each person has a right to good care and considerate treatment. So last year we had an ER nurse come in, and no, she wasn't an ER nurse. She used to be I forget which area she worked in. Well, she was a nurse. She is a nurse at Memorial, and she had a patient come in, and it was a repeat patient who would come quite often, who would overdose on drugs. And she made the comment that she always spent extra time with that patient. Because no matter what, he was doing drugs, shouldn't have been doing them, and knew that if they released him, he would probably come back again. But he was still somebody's son, somebody's brother, maybe somebody's friend. And he still deserved all the care and the best care that he could get compared to anybody else there. So just remember that everybody who comes in is somebody's family member, and treat them as if you would treat your own family member. And those who are alcoholics or who do drugs, they made a great choice to do those things. But also remember that more than likely that first time they did drugs or that first time they took that drink, they never thought, "Ooh, I'm going to ruin my life and my family members by drinking or by doing drugs." Um, that wasn't their intention, and it's very, very hard to stop doing drugs. It's very hard to stop drinking if you're an alcoholic. So no matter what, whoever that person is that you're treating, whatever their case may be, don't judge them and just give them the best care that you can give them. At times, it can be extremely difficult, and patience and practice are essential for treating all patients equally. When individuals have a negative attitude or constantly complain or criticize your work, it can be difficult to show them respect. A healthcare worker must learn to see beyond the surface attitudes of the human being underneath. And I've discussed before how it's hard to be a patient. It's hard to be in the hospital. And a lot of times that's not going to be who they normally are. They're under stress, they're frustrated, they're upset, they may be angry at whatever is going on. I have a friend who is a dispatcher for 911, and she received an apology note later on from somebody who had yelled and screamed at her on the phone, and later on had apologized to her, and actually I think sent her some chocolates or something, saying that's not who she is normally, and she was apologizing and that she shouldn't have behaved that way. So just remember that your patients are under stress just by being a patient. Frequently, fear is the cause of anger or a negative attitude. Allow patients to express their fears or anger, encourage them to talk about their feelings, avoid arguing, remain calm, talk in a soft and non-threatening tone of voice, and provide quality care. If they're angry and upset, it's just best to listen to them. If they have a complaint about their care that they're getting, again, let them complain, listen to what they say, and when they're all done, reflect what they said, like we talked about earlier. So just repeat what they said so you can make sure that you have it correctly and they know that you listen to what they say. And then just say, I will let my manager know. Well, I will make sure we get it. I will try my best to get this taken care of and see what we can do to help you or to provide you the care that you need. Don't make promises that you can't keep, especially if you don't have the authority to do that. But it's really good just to let them talk, and so a lot of times they just need a voice what their feelings. Other healthcare workers may be able to communicate more effectively with patients, and they're very good workers that you want to watch and listen to and learn from them. Often this is the most effective means of learning good communication is by watching and listening to others communicate. I think we are going to stop there. That is long enough for today. So we will stop there.